everybody, welcome back. This is our second session with Laura Smutz. You guys have seen her before, where she went through, the basics of exosomes, why she does what she does, why she thinks exosome is an exceptional addition to any treatment. Today, we're going to go in depth and I'm going to try and ask her questions which should help you in deciding what treatment is good for you and why you should now step into regenerative treatments. So thank you, Laura, for joining us again. I really appreciate it. How are you?
I'm doing well. Thank you so much for inviting me. And I can't wait to go further into depth about something that I'm super passionate about, which is regenerative aesthetics. Like that is where the forefront of aesthetics is going. That is what everybody is wanting. We're wanting more natural, more organic things. And we just want to do things that enhance our beauty without potentially augmenting us. So that's where regenerative treatments really come into play.
I thank you for that. I always wanted to ask you this question. I mean, I do know this, but I want our audience to know, why did you decide to come into aesthetics?
Well, it's actually really funny and quite a long story, but I will give you as much of a snapshot as I can. I was working when I first graduated from PA school. I was working in cardiothoracic surgery, and I was working 70 hours a week. I really loved what I was doing. I was, like doing surgery all the time, like helping people with their hearts, helping people with their lungs. But it's a really grueling type of atmosphere because you're constantly dealing with people on the end of the spectrum where it's like life or death. Well, I was 28, 29 years old, and I woke up and I looked like death. I looked so tired, and I looked like I was 40 years old, and I was the prime age of 29. I went and got Botox, and they actually dropped my brow.
Oh, hence the video you just recently made on Botox.
Yes.
Thank you for that. It was very interesting.
So they dropped my brow, and I was like, well, I can't do worse than that. Like, I know I won't drop people's brows or will do everything I can not to. So I decided to pivot my skills into facial plastic surgery. So then I was doing like facelifts, no rhinoplasties, like nose surgery. I was doing eyebrow lifts, all things on the face types of surgeries for aesthetic reasons, and doing aesthetics at the same time. Like at the time, it was just really Botox and filler. And then I've slowly transitioned into only doing cosmetic derm, which is where my heart is.
So probably this is one of the reasons why you're so into the details of small little things, and versus, a lot of people, when you go to them, they're more like, okay, yeah, this is the problem, get Botox, or this is the problem, get microneedling. You first explain everything. Like yesterday, I was asking you about if I should go with the laser, and you did not even talk about laser. You started with my complexion and where I come from, and how it would affect me. Like if I would go to anybody else, they would like, yeah, let's do laser, like without letting me know how it could affect me or how I should actually take it. I think there was something you mentioned about we'll have to break your melanin apart, make sure they don't go all crazy with sugar. It was a really interesting way of how you explained it to me. So thank you so much for that.
You're welcome. You're welcome.
Yeah.
I think that education is ultimately the best thing that you could do for all patients. And I tell patients that I want to work with them as part of a team rather than me being the dictator or them being the dictator. I really don't like either one being the dictator, meaning like you were saying, like you're sitting in the chair and you say you think you want lasers and they're just like, oh yeah, like go for it. Well, you don't know the side effects of it because it's not your job to know that. It's my job to know that. And it's my job to educate you on what's best for you and get you the outcomes that you ultimately want. I tell people all the time, I don't know why we're talking about death so much in aesthetics, but I tell people I want to go to the grave with them.
That's so awesome.
Morbid tonight. I don't know why. But like, I want to create that long-term relationship. So if I think that that's the best thing for you, I'm not going to let you do it because then you're going to end up feeling worse than you felt before you came in trying to fix the problem that you're coming in for.
You know, I love the way you talk, and it makes me want to ask you questions that are not in my list of questions. But I do want to point something out. A lot of people do not understand this. You know how you say, "Oh, I'm not going to go to any doctor other than the one I trust." It should be the same with aesthetics. A
Yes.
lot of people think, "Oh, they're giving out a deal. Let's go there." Oh, go there because they're offering this and that, or they have something new. Just because they have something new or they're giving you an offer does not mean they're great for your face. Your face is your everything. That's the first thing that faces everybody else in the world. So I think it's very important that you trust your esthetician.
Yes.
They're not just explaining to you what's good for you in the right way, in the most layman possible way, but also that an esthetician should be very up to date on what's going on education wise, research wise. And I think one of your key points in your strength are that you're always updated on what does what and what's good for my patients. And I'm not going to do this anymore. That is what I actually love about you the most. All right, next question.
That's very kind. Thank you.
It's gonna be personal. Wow, we're going in depth this time. You have a beautiful skin. Finally, we want to know, what is your skincare routine? What is that secret you would like to share with our audience to have a face like that?
So I get this question a lot, and it's a hard question to ask or answer. I always tell people the first and best thing that you can possibly do for your skin is to have sunscreen on your face. And like fun fact, like putting sunscreen right here, which listen, I didn't do till I was probably 3 years ago. It actually helps the most because this is the thinnest skin on
Wow.
the face of the planet. And so this is the thinnest skin on your face. And so as the sun hits it, it is actually breaking down collagen. And collagen
Oh,
is the structure system of your face. Yeah. And so if you can imagine, like start feeling heaviness right here, well, what if we can just prevent some of that heaviness from occurring by putting sunscreen above our eye on our eyelids all the time. So when I get patients in here who are 30 years old, who are 40 years old, I tell them, listen, you need to start doing it today or yesterday. And then it's still never too late. So even if you're like 50, 60, 70, like still start. So that's the best thing that you can possibly do is use sunscreen. The second thing that I usually get people on, are actually it's like a trio, is vitamin C, retinol, and hyaluronic acid. And the
mhm.
reason is because those are anti-aging. They work together to make the best results. Retinol is anti-aging. It's been around forever. It helps turn cells over, and it also helps thicken up the top two layers of your skin. It also helps with texture. Your vitamin C, I always call your retinol your Beyonce, by the way.
Oh,
Yeah, so your retinol is your Beyonce. The other two players, your vitamin C and your hyaluronic acid, are kind of like Beyonce's child. The two people who you don't know their names, those are very important because they're in the band, but you only know
yeah,
Beyonce.
yeah.
Uh, so your vitamin C makes your retinol more potent, and then it also helps overall with brightening. And then your hyaluronic acid provides the atmosphere to build said collagen that your retinol is trying to do. So they all work together. Those are the three most important skin care that you can do on top of your sunscreen.
So, follow up question. Can you just take vitamin C and collagen in capsules and all, or we're talking about serums and something to put on the face?
On the face, on the face.
Okay.
So vitamin C is an amazing antioxidant. It's also an amazing antioxidant to take orally. It helps with a lot of things. It helps with immunity. During COVID, I actually would take over 1,500 milligrams per day because it's proven in that type of dose to actually help prevent getting infected at the time. So I would take it all the time. I still take vitamin C to this day. But if you are trying to help with your skin, you need to put it topically. That's where like even exosomes come into play, and you need to put it where you want the results.
Amazing. Thank you so much for sharing that. I really absolutely love when you explain the way you explain. Um, let's get into your favorite stuff.
Yeah.
What is your favorite treatment to date right now?
My favorite to do on patients or my favorite for myself? Because that's
Me.
different.
Let's start with yours.
Okay.
We want to get as many secrets out from you today as
Uh,
possible.
yeah, my favorite treatment on myself is actually going to be microneedling with exosomes. I think that it like I just did it like 4 or 6 weeks ago, and it really helps your skin with the reflection and just looking dewy. So I get a lot of patients in here. I just had one the other day. She came in for a new consult and she said, I feel like my skin is looking old. I feel like my face is looking old. What can I do? I think I need filler. And I actually talked to her and I was explaining like filler is going to help fill your face. And I am
Mm.
from Georgia, so I think of filler as fill her up because that's a Southern term. Um, so you can fill her up all you want.
Yeah.
Skin quality speaks more of your age than volume loss. And so I was really telling her, like, hey, if you're trying to look like a little bit more illustrious and like a little bit more like rejuvenated and refreshed, we need to handle your skin quality. So I really like microneedling with exosomes, lasers with exosomes. That's what I offer here in our office because working on that skin quality and getting it to where it just like reflects light is going to make you look more youthful than if
Hmm.
we just put volume in your face. And not to say like for her, I'm not going to put volume in her face later with filler, but first step, let's take care of the skin.
Yeah, it's such a big difference. A lot of people don't understand this, that there is the difference between a balloon filled up
Yes.
versus how a bulb glows. You know how a light glows? They all look the same in shape, but there's a difference, right? And when people keep saying, because I had that problem before I started exosome, my face looked tired and tan after work, because when you're doing 10 to 12 hours in front of a screen, two monitors,
Yeah.
lights, yeah, that involved with stress and hardly any sleep or no fixed time for sleep, it takes something away from your face. It's not just about filling it. You're absolutely right. Um, you want the face to be like a light bulb, right?
I
Um,
love that reference. I've never heard that reference. I wish I would have talked to you a couple of days ago when I was talking to her because I feel like a big balloon, the same shape
yeah,
bulb, but one is like nice, shiny, and bright, and the other one is dull. Like that's amazing.
yeah. I
Yeah.
mean, a balloon filled with water is
Yeah.
like fillers,
Yeah.
okay? And then a bulb. I mean, you know how you go to Home Depot and there's a whole line of
Yeah.
lights standing up?
Yeah. Yeah.
Exosome does that. Thank you so much for that. Okay, let's see. So, what do you think are the best treatments for women over 25? What treatments they should start with? And same for 35 onwards and 45. I want to know, if they come to you, what is the first thing you would check, and what would be the most common treatment you would,
Yeah. Yeah. So
decide for them?
in your 20s, it's going to go back to your sunscreen. So we really want to prevent, and then continue to increase your cell turnover. So when you are nice and young, your cells turn over from the bottom layer to the very top layer that we're seeing right now. It turns over pretty quickly, about every 21 to 25 days. In life, our skin cells actually start turning over very slow, and they get slower and slower and slower. And so if you can imagine, if a big, healthy, juicy cell is at the very bottom, and as it gets to the top, it gets very, very thin. Well, if it takes longer for that to happen, then these cells get super dehydrated and very dull looking. So increasing your cell turnover when we're nice and young, keeping that up, that's what you want to do in your 20s. When you're in your 30s, we're starting to like have kids possibly. We're starting to, have full-time working jobs. We are exhausted. So this is where we start to again kind of prevent with a little bit of Botox, like a little bit of Botox right in here to help prevent these wrinkles from even occurring. And then we're also starting to think about regenerative treatments.
Hmm.
Usually after about 35 is where I say like and it varies based on person to person, but So let's start microneedling. Let's, like, again, my favorite treatment. I'm in the 35 to 40 range. So like, that's why I love microneedling, because it like, so you want to start thinking about like the lighter regenerative treatments, like your microneedling, like all of that kind of stuff, which is going to help. Exosomes like PRF, like all these things that are really helping to like increase your ability to produce your own effects. Then when you hit the 40-year range, that's when menopause starts coming into play, which that dreaded menopause, she's awful. We need to do even better with our skincare, with our sunscreen and our skincare. So I typically kind of ramp it up a little bit, which like now we need to start thinking about your skin barrier. So your skin barrier breaks down over time. And that is something where I like to think about it like, if your skin barrier isn't good, kind of like if the road, it has a bunch of potholes in it, then you're going to drive and you're going to be like, doom, 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 doom.
Yeah.
Your skin barrier starts doing that. It starts like having like lots of little tiny holes everywhere. And so we really need to reinforce that with skincare, helping to rebuild that, because then your skincare doesn't actually work if you don't use the right things. And then a little bit more advanced regenerative treatments, possibly a little bit of filler just to help out here and there. And then when you're in your 50s, your 60s, and your 70s, that's when we start thinking about more like advanced laser treatments. That's where we want really good resurfacing treatments. Here in my office, I have erbium laser, which is erbium laser. It can also be like another not similar name, but name that people know of is CO2. Erbium is newer technology.
Now that's what everybody knows. Yeah.
Yeah, erbium's amazing. I love it. It does a really good job of like shrink wrapping the skin, helping with tissue laxity, helping with these advanced signs of aging to really turn back the clock. So based off of like all of those different decades is what I usually do.
I noticed you didn't really mention filler, Botox, or anything of the sort for someone under 25,
No.
which was very unique. Usually people, estheticians, don't care what your age is. If someone's come in, oh, I want this and I want that, they'll be like, okay, yeah, let's do an appointment and let's get you there. I really like that you did not mention any of that in that age group.
No, I don't really love doing Botox where you're trying to alter something. So like for me, for instance, like I have filler in my jawline because I have a Irish chin. And so I would have a very recessed chin. So these women that come in that are looking for like a little bit more projection out, that's where that really helps. But if you're looking for just rejuvenation, you don't need it right then. And then as far as Botox goes, I tend to do very small units because we don't have wrinkles. So we don't need to correct these wrinkles. If we do Botox, then it's very minimal.
Got it.
Yeah.
Okay. I'm going to ask you a very general, common question, but I think it's very important that this should be asked for someone who's actually well aware and well informed and educated. Um, what are the things we can do or products one can add to slow down aging specifically? I know you're very big on sunscreen.
Yeah.
Anything other than that?
Like products wise, like
Yeah,
skin
or treatments, whatever you would recommend. Let's say I'm in my 35, 30s, or early 40s, or late 20s. What should I be doing to really slow down aging?
That's a great question. Um, I think going back to like just regenerative treatments, like you can cherry pick regenerative treatments. That's the reason why I love regenerative treatments, is because it's requiring your own body to produce its own effects. So collagen lasts for 17 years, which is very interesting. The collagen that we make today will last for 17 years. So if you're in your
Oh, that's
30th decade,
amazing.
I know. So 3 years ago, we would have told you we don't know how long collagen lasts. Like it lasts for many years. Who knows? But then there was a study that came out in January of 2024 that showed that from punch biopsies that the collagen type 1 in your face lasts for 17 years, which is really interesting. So if we can really build it up in your 30th decade, it's going to last you until you're in your 50th decade, potentially, which is kind of cool.
Wow.
Yeah. So that's what I recommend is like, let's build that collagen in your 30th decade. So then when you're in your 50s, you don't need a facelift, or you don't need a facelift till you're 60. Or if you want one, then you have better quality skin.
And exosomes helps with that.
Oh, yeah.
So the sooner the better then.
Yes. Like exosomes are going to help you produce new baby cells. So, like, who doesn't want new little baby cells?
What is the most common issue that your patients come with?
Recently, the most common question that I've had is a lot of like, my skin looks dull. I'm going through menopause. I need to know what is helping me. Like, I just had one today. I had one a couple of days ago. I had one yesterday, and like, it's either like the neck or the face is just starting to look a little bit dull. I feel like my face fell down in the last 6 months.
Wow.
And I like to tell women that, I like to walk them through like how estrogen is made and like what's going on with menopause and after menopause. The skin is really the only organ that is producing estrogen because your ovaries are no longer producing it.
Hmm.
So that's why skin quality and skin health is so important in your 40s, 50s, 60s, because unhealthy cells make unhealthy or not enough estrogen. Healthy cells make more estrogen. And that's why we really focus in your 40s, 50s, 60s, and above on your skin quality.
I think it's important for people to like do at least 6 monthly or 1 yearly like consult with a trusted esthetician just to make sure that it's taken care of before it gets aggressive.
Yes. So in my office, we do rolling treatment plans all the time. And then we do roughly about every year, we do another fully in-depth plan where we're looking at where we came over the last year. And then we're going to talk about where do we want to go over the next year. So in my practice, we're constantly looking at befores and afters. Like, I look at befores and afters all the time. And the reason is because you can't, if you don't know where you've come from, you don't know where you're at. And if you don't know where you're going, then where are you going? You're just kind of like wandering. And so we
And
really,
then it gives you a chance to keep them beautiful, isn't it?
it
Keep
gets,
them beautiful and young as possible. Of course, age is going to go forward, but having that kind of record, month based, year based, is absolutely amazing.
yeah, yeah. And I hate the term like, I want to age gracefully. Like, I hate that, like, whatever aging gracefully means to you. Like, sometimes I get patients in here and they say, I don't want to do Botox because I want to age gracefully. Well, I'm sorry. Like, I'm aging and I'm technically aging gracefully because, like, you just said that I don't look my age. So, you looking 50 when, like, not you, Dr. Asma, but like the individual, like, looking 50 when you're
Yeah,
40,
yeah.
is that you graduate aging gracefully? If that's your definition,
No.
then that's great.
Yeah.
But my definition is that, like, hey, like, I want to continue to look on the outside how I feel I look on the inside. Um, everybody's version of aging gracefully is different, and let people be them. Let them do what they want.
Yeah. Listen, I saw a huge change when I turned 37. That is when I could see in the mirror something's changing.
Yeah.
Everyone has their one that year. It's
Yeah.
different for everybody I've seen as a
Mhm.
doctor. I feel that some people don't look their age at 50. I mean, but if anyone thinks here, and this is for everyone, if anyone thinks here that you look 25 or 30 when you are actually 65 or 55, that is not just on your own. You are taking help. You're not talking about it, but there's help. They have a proper esthetician, doctors that help them look that good in that age. But I feel one thing that I could have done better was when I started seeing the changes, I think I should have started going to an esthetician to see how I can delay that change. So I do things now, But I feel that if I would have started then, it would have been so much better. If I can have a regular dental checkup and a regular physician annual checkup, why is it not like that for aesthetics and hair and face? I think it's very important that one should have that, you know.
I
Um,
I
Go
think that
ahead.
that's very important too. I mean, and like so when I'm 65, I actually want to look 65. I just want to look really good for a 65-year-old. And when I'm like now
It's a
I'm
good way to say it. Yeah.
yeah, and when
Yeah.
I'm 39, I technically I want to look 39, but it's actually really cool because like my husband and I we're gonna go to his college reunion next year, and
Oh,
like everybody, like whenever they come to visit or like whenever we see any of our college friends, like it's so funny because like they constantly say, oh my gosh, Joe, you look so good. That's my husband's name. He's like, Joe, you look so good. And he doesn't really like to tell people what he does, although whenever I have a couple of drinks I always rat him out. But like I think like
so
you
cute.
I can see his confidence change
Oh,
because
yes.
people constantly talk to him like they know what I do, so they expect like that I have good skin.
Yeah.
But like they don't necessarily know that he gets treatments, and so it's really nice for him to like have the confidence that like hey, he's 42, but he says like I look really good for a 42-year-old, and I think that's what aesthetics is like feeling confident in the skin that you are, and then not having to like look in the mirror to see if you need to cover your under eye circles, not having to look in the mirror because you need to cover your acne scars or your hyperpigmentation, and just knowing that it looks good and it's one less stress of the day.
Oh my God, yes. Men need to step up their game.
Men, women, all of
Yeah.
us.
I think that skincare and treatments that you need, you should go get them. And
Yeah.
everybody deserves that. That is the best. We saw an amazing video on Instagram about how Botox can feel heavy.
Yeah.
I want you to just briefly explain that here also for our audience, anyone who didn't get a chance to see it.
Yeah, so Botox, I actually just had a patient who had I get a lot of complications from outside places where they will send me their complications, which is good that I can help them. So this one woman, she came in because she was feeling super heavy in her forehead, in her eyebrows. She said like she felt like her eyebrows were just on the ground. And the way I like to describe it is you feel like you need a cane for your eyebrows to like lift them up in order to drive because you can't see. But she got too much Botox in her forehead. And so the forehead is one of those muscles that is super, super sensitive to Botox. And since it naturally lifts your eyebrows up, if you Botox it, it relaxes that muscle and can drop the muscle, dropping the skin with it. So that's what leads to forehead, your eyebrows feeling too heavy. There's too much Botox in your forehead. Or
You you showed this little thing how you make sure that it doesn't happen. Can you just, tell us that?
I'm a psycho. So I draw on people. Early
Yeah.
in my career, I felt like, well, actually, early in my career, I felt embarrassed to draw on people because then I felt like it would show that I didn't know what I was doing. And then I was then too cocky in my career in which I didn't think I needed to draw on people. And now I have let my ego go aside, and now I treat and respect that muscle, which is called your frontalis muscle, with the respect that it needs. Meaning, I draw on people's forehead. I put my fingers to like inhibit certain movements, and then I see how the muscle moves in isolation, making changes again by drawing dots. And then finally I inject. Typically the first time I meet you I inject very conservatively, knowing that at 2 weeks
Hmm.
might need to come back and get a touch-ups are always 100% on me, but I would rather you feel like you have too much movement needing more Botox and meaning you get a free.
Versus everything frozen and
Yes.
falling down.
Yes. Yes. So I play it like that. I treat it with the respect that it needs to have. And then I sometimes will go conservative, knowing I might need to sacrifice a little bit of my free Botox on them, but willingly doing so.
Because you're result oriented, and I think the change you spoke of, drew, not drew, drew again,
Yeah.
shows how you've matured with time,
Yeah.
as an esthetician. That's absolutely amazing. I'm introducing an amazing drink pretty soon. Can you expand a bit on that? I want people to know about it because I'm very excited about it.
Yeah, it's coming out in the beginning of next year. It's called Foundations, and it is a regenerative drink that is meant to go alongside of any kind of regenerative treatment that you are taking. So exosomes, PRF, lasers, microneedling, Sculptra, even Radiesse, Easy Gel. Like the list can keep going on and on, but it optimizes your ability to produce collagen. So all of these treatments, all of them require your body to produce collagen to produce its effects, its results. If you can't produce the collagen that it wants you to produce, then you don't get the results. Meaning, if I'm trying to build a 2-story house, but I only have enough building blocks to make a 1-story house, I can't make that 2-story house. The same principle applies to collagen. If you don't have the right amino acids, minerals, vitamins, you're not going to get those results. So this is meant to optimize that and give people the results that they're seeking. So I can't wait to help all the patients all
Oh
around the
my
nation
God.
with this. I am bringing on a laser. It's called the ultra clear laser. And we are offering that to new patients, my patients, any patients. We pair it with exosomes. So we are giving like a little bit of a significant discount on that. As we roll that out. I'm going to be a preceptor for this company as well, which I'm beyond excited about and honored to have that position. So I can't wait to share with everyone and give them the results that they want.
Oh my God, that's so awesome. Like, so
Yeah.
we're getting a drink, we're getting the, discounts. Sorry, I have to. Okay. um, so I know, I've asked you a lot of questions. I know you love microneedling with exosomes. I know
Yeah.
you love that. And I know that you are really excited about this laser with exosome. Who do you think should come for these, and why do you think that these two are the best treatments right now when it comes to regenerative and like treating different things? Well, should kind of discuss this.
Yeah. So I think that anybody who has a face could benefit from microneedling and or lasers with exosomes. So if you are an individual with a face, then you should come and see
I
me.
love how you put
And
that.
the reason is because like if like even again, like even if you're 20, 30, like really young, like let's start turning these skin cells over and let's start preventing these problems in the 4th decade, the 5th decade, the 6th decade. If you're in the 4th decade, the 5th decade, the 6th decade, you're either premenopause, postmenopause, perimenopause. We're wiser, we're had a lot of birthdays behind us, we have advanced signs of aging. All of these regenerative treatments can help you.
Amazing. I I know we're not discussing me today, but I do want everybody to focus on my face right now. And you will see that I've been, for my test, of course, being associated to a company that produces the best exosomes in the market. You do kind of want to try on yourself, right? So if you check my face right now, yeah, you'll see that it's more droopy on this side versus that, because I've been using our exosome serum on this side only to see what results I get in 2 weeks. But I kid you not, guys, there is nothing out there right now that can help you more than the latest technology like laser, paired with the best exosomes ever, paired with the most trusted trained partner right now out there. You have to be very careful. Someone might be really nice as a, doctor and esthetician, but not have the latest technology or using the best product. So it is your right, whenever you go to see somebody for a problem that you have or a problem that you think you might have very soon, You need to ask questions from the partner. You need to make sure that you're absolutely sure that you are well informed and you're getting the latest technology and the best products out there. There's just so much noise right now, Laura, when it comes to regenerative products.
Oh, yeah.
Yeah, so much noise. Okay, you need to be very sure of what you're putting in your body. Okay, it's an organic material. You want to be sure it's the best quality, it is tested properly, and the person who is administrating it is fully trained and knows what they're doing, and that's the best choice for you. So you have the right to ask questions, not because you're paying for it, because you're getting changes done to your body. So be very, very careful about this. Laura, thank you so much for your time today. I really appreciate it. I think we're going to get to again, probably for a more in depth um, podcast or, live session or whatever you want to call it.
Yeah.
And next time, hopefully, you're going to have more promotions and discounts and something new to tell us or have your drink ready to launch. But thank you so much for your time. I really appreciate it.
And I just want to thank you. And I just want to back up with what Dr. Asma was saying is that you want to make sure that you're going to someone who is using the right ingredients. And I hate to say it in today's society, and I don't want to like cause any like anxiety or angst around it, but I mix my Botox in front of patients. I pull my exosomes up in front of patients. Like I do everything in front of patients. And sometimes like new patients will say like, what are you doing? Because I'm doing my own science experiment while I'm talking to them, like pulling it up and like doing
Mhm.
things. When I do filler on patients, I bring the box into the room. I don't bring the syringe. And so I just want people to know that everything that you get from this office is 100% FDA regulated. And so also don't be afraid to like ask your
Yeah.
injector or your provider like, hey, where did that come from? Can I see the bottle? Can I like witness where it came from? Just, have a cautious eye. So that was a great point that you made, Dr. Asma, and I just
Yeah.
follow up on that.
You
But
should, and you can search within a second on your phone what this product is, where it came from. Thank you. Thank you again.
thank you.
I know it's really late. Okay.